Hydrogen sulfide is one of the important gases in the curriculum. It is covered in domain 10, 20, so it is important to know acute management as well as how it interacts. Normally it says it has rotten eggs smell at the low concentration. However, odor is not a reliable warning, and when concentration is higher than 100 ppm, hydrogen sulfide can cause olfactory fatigue or paralysis. So the worker may lose ability to smell it precisely when it becomes most dangerous. By nature, it is a colorless gas and it is heavier than air and moderately soluble in water. High-risk industry or situation scenarios we need to know for work and exam is sewers and wastewater treatment plants, and sources include anaerobic decomposition of organic matter, confined spaces, tanks, pits, manholes, and ship holds, manure pits, livestock operations, mining, particularly around geothermal areas, sulfide ore processing, in the oil and gas extraction, petroleum refining, in the paper, pulp and paper mills, craft pulping process, tanneries and rendering plants, geothermal power generation, and laboratory setting where chemical reactions are used. H2S is denser than air and accumulate in low-lying enclosed spaces. Disturbance of settled sludge or organic material can usually cause sudden release of large volumes. When we are thinking at mechanism of toxicity, it inhibits mitochondrial cytochrome C oxidase by binding to iron molecule there, so it stops cellular respiration, causing cytotoxic or histotoxic hypoxia. Mechanism is similar to cyanide poisoning. The difference is that H2 binds cytochrome oxidase reversibly at lower dose, but at higher concentration, the effect is rapid and profound. Other mechanisms may include mucous membrane irritation, direct CNS toxicity, causing pulmonary edema and myocardial depression at higher dose. So it impacts all the organs that has high oxygen concentration. In the exam, the usual question is how does H2S affect us, particularly as an asphyxiant gas. So in the oxygen depleted atmosphere like confined space, it displays oxygen as a simple asphyxiant, and it can also act as a chemical asphyxiant. Not all the scenarios may be applicable, but we need to consider that it may not be just a simple chemical asphyxiant. Same with anything, there is dose-response relationship with H2S. We have a workplace exposure standard for 8 hours is 10 ppm, whereas the short-term exposure limit is 15. And there was a question previously about whether TWA protects chronic or long-term effect. TWA would protect acute toxicity. TWA is directed towards reducing long-term chronic effects, whereas STEL is directed towards preventing acute effects, such as bronchospasm and mucous membrane injury. WES also doesn't protect all workers. Susceptible individuals such as asthma, people with asthma, or any pre-existing airway disease may be affected at the lower levels. Acute exposure, we usually imagine that someone collapsed or sudden loss of consciousness called knockdown when in the high dose. However, in the lower dose, mild to moderate dose, it may cause eye irritation, tearing effect like gas eyes, headaches, nausea, dizziness, upper respiratory tract irritation, and throat irritation. That has similar effects like CO effect, carbon monoxide. At the severe dose, it may cause seizures in the brain, in the lungs, pulmonary edema, in the heart, myocardial ischemia, and death and respiratory arrest follows. There was a question previously about subacute presentation in a firefighter experiencing nausea, eye and throat irritation, and dry cough for a few hours, initially discharged by the medics as well, and then some difficulty of breathing for a week later. And this pattern illustrates that there may be initial irritant effects, possible delayed pulmonary inflammation, and gradual resolution. So how about chronic low dose or repeated exposure? The same symptoms but milder. Chronic eye irritation, chronic rhinitis, pharyngitis, headaches, fatigue, you can name anything that may experience. And the olfactory impairment is something important to know. People who are used to that smell may not notice any change. Long-term neurological sequelae is important to know that may happen following acute exposure. Symptoms such as persistent cognitive deficits, Parkinsonism-like features, cerebellar dysfunction, and neuropsychiatric symptoms might be problematic. For the treatment and management, this is a commonly asked area. The resuscitation is that rescuer must not enter into the confined space without self-contained breathing apparatus or SCBA, and many H2S fatalities are or would be rescuers. The main thing is we will give high flow oxygen 100%. It will compete with H2S at cytochrome oxidase. This is the single most important treatment. Decontaminate, remove clothing, and irrigate with water and saline to the eyes. We should follow the normal resuscitation. There is no difference here, and we would continue monitoring while the worker or the patient is transferred to hospital, secondary or tertiary care. We also need to know some general treatment in the hospital. High flow oxygen should be continued. The treatment is mostly focused on the symptoms and complications like pulmonary edema need to be managed based on severity, so supportive care. That may include IV fluids, bronchodilators, and mechanical ventilation if needed. If there are seizures, benzos will be useful. There is historically use of the nitrite therapy, but you may or may not mention at the exam. The key is that there is no specific well-established antidote for H2S poisoning. Cyanide has hydroxycobalamin, but H2S doesn't have anything much. Ongoing management is that we will need respiratory surveillance depending on the severity and the recovery, and we need to assess fitness to return to work. One of the old questions was that PTSD assessment in a firefighter who lost one of his mates in the similar situation with manure pit in a I think it is in an abattoir. So in terms of risk assessment, we need to, if we can, prevent conditions that will allow anaerobic decomposition when possible, and use aeration in wastewater treatment. In terms of engineering, avoiding the confined space in the design step. Otherwise we can use ventilation and continuous atmospheric monitoring if it is applicable. For administrative control, we can have confined space entry procedures. Identifying confined space, potential confined space are important. Some location may not be confined space depending on the situation, so they could be dynamic. There has to be a permit to work system. Gas testing before and during the entry could be done, and usually the trained standby person at the entry point having emergency rescue plan and equipment. For PPE, SCBA, self-contained breathing apparatus are important for emergency workers or high concentration situation. We can also use airline respirator as a substitute, and we need to have the chemical first aid facility in any workplace. That's something important to know about H2S. There is no specific health surveillance for H2S exposure prone work, but it may be relevant to the job they are doing that will make them exposure to